Hello, ladies.
Hello.
Welcome to today's session where we will be discussing the impact of COVID-19 on women and how equity, present and future, is absolutely necessary to support working women and their chosen roles as breadwinners, contributors, and mothers, or some combination of the three. So I am Michelle Robinson, and I have the absolute pleasure of moderating our session. During the week, I work in talent acquisition at Sodexo, which is a global quality of life services company. And actually, for the past several months, I've been moonlighting in our Office of Diversity as a global director of diversity initiative, which is extremely exciting. As you can probably imagine, it's also taxing work in light of what's going on in this country around race relations and this horrible pandemic. But in addition to my career, which is extremely important to me, I also wear several other hats, which are actually even more important. I am a mother to a very active, talented, and inquisitive, and so that's code for she asks a gazillion questions, 9-year-old. I'm also a wife, a leader in several civic organizations, and an active member of my church. So in other words, I have a lot going on, and COVID-19 has definitely made juggling these different roles more challenging. And actually, the same can also be said for our three panelists, who are all working women at different stages in their careers and lives. And you'll also hear more about them as we delve into our topic. But our panelists include Dr. Joyya Smith, who is the VP of Diversity, Access, and Inclusion at Suffolk University. We have Dr. Cheryl Clark, who is the Assistant Professor of Medicine at Harvard Medical Center. We also have Dale Merrill, who is the SVP Human Resources and Administration at Mashantucket, Pequot, Tribal Nation, and Foxwoods. Welcome, ladies.
Thank you. Thank you.
So before we dig into our discussion, I want to set the stage for our audience. So let's take a journey back in time. Let's think about before the pandemic. So before the pandemic, unemployment was 3.5%. Women were active and participating in the workforce in huge numbers. However, women did face, at that time, at least a century-long wait to reach parity with men. But they were making, we were making strides. Also, in families where there were two parents, in many cases, both the parents were working outside of the home, and this was either by choice or out of necessity. But as a result, many children were in childcare while their parents worked, which again, I mentioned that daughter, I can personally attest is a huge expense. And so then after coming home from work, or I should say their day job, many women had to help with homework, they had to make the dinner, they had to shuttle children to and from their activities. Many women were caring for relatives. And guess what? This was all unpaid. So let's fast forward to today. We are in the midst of a global pandemic. COVID-19 has descended upon the world and has upended both women and men's lives. But I think it's safe to say that women in the workforce compared to men have been disproportionately affected. So let's think about where are we today? Currently, women's labor force participation is at a 33-year low as more women take on the caregiver roles at home due to remote schooling. Also, for those women who have the luxury of working remotely, which I do, and not having to commute to an office, they're now having to, in addition to work, they're finding themselves being the teacher, they're the lunchroom worker, they're the principal, or any other jobs. So these jobs that they didn't even sign up for. Also, in terms of pay, women actually earn 82 cents to every dollar that a man makes. So there's a huge disparity there. And so with mounting pressures to be everything to everyone, many women have actually decided to leave the workforce. And so there's this term that's been coined, the she session. So not a recession, but a she session. Now that you have an idea of the landscape, we're going to hear from our expert panelists to weigh in on some of these topics. So what I'd like to do is ask each of you to introduce yourselves briefly and then share a little bit about your background with our audience. So I will start with Joyya.
Good afternoon or good morning, everyone. I'm Joyya Smith, and I currently serve as the Vice President for Diversity, Access, and Inclusion. And I have worked now in higher education for the last 20 years, and the landscape of higher education has completely shifted. The pandemic has done a number on higher education, but it's a wonderful opportunity for us to recreate what life can be like for those who are connected to higher ed. In terms of my background, additionally, I serve on different boards. I'm active in my community. I'm unmarried and don't have children, but I am a person who is connected to my family and friends in a way that really has been helpful to me during this pandemic. So that's just a little about me. So thank you, Michelle.
Awesome. Okay, so Cheryl Clark.
Good morning, everybody, and thank you so much. Just wanted to thank the organizers and my co-panelists for having me here. Just really excited to be in this space. And, by way of introduction, I am a physician of internal medicine, a hospital physician called a hospitalist. And so I don't have a clinic. I just see people when they come in the hospital and sort of stay there. I'm actually in the basement of the hospital right now. So you see that background. It's just kind of like at work. And so really like I'm in my workplace right now. And so we can talk about what that looks like. It also gave me an opportunity to see COVID, to see coronavirus firsthand. As a hospitalist, we were one of the frontline workers alongside folks in the emergency departments and in the ICUs who took care of patients during the first surge who had coronavirus. And so we can talk about that and sort of what that looked like. And particularly as we think about how women are affected, women of color, we were able to see that firsthand. And I'm also a researcher. I conduct what's called health equity research. So really trying to understand how the social environment influences our health. And so very excited to have this conversation today. I really appreciated also the way that we acknowledge the many roles we wear and take on. I'm a proud daughter. I'm from Illinois, Harvey, Illinois. My parents are there south of Chicago, proud sister, a proud wife, and have two little ones who are my pride and joy. And just, this is just such an important time, for us to have this conversation about all the different roles that we play and how we can support each other as women in the workforce. And so I'm just happy to be here. Thank you so much.
Thank you. And last but not least, Dale.
Hey, so I'm so happy to be here this morning too, and very humbled by it. And, I'm sure you've heard this a couple of times, Cheryl, but I'm going to start with you by thanking you. I have a few friends in healthcare, and you have seen things that I think many of us cannot understand or appreciate, but the fact that you're here and smiling and optimistic about our future is very telling. And so thank you for that. I want to just thank Anna for inviting me to this. There was a moment where I was like, I'm so not worthy to be sitting amongst these amazing women that I'm sitting next to, and can't wait to a time when we're actually physically sitting next to one another. But thank you, Michelle, for laying that out. That was beautifully laid out. You laid that landscape out. I almost wanted to launch right into the conversation because you just were like, let's go with this right now. She laid it all out. And then of course, Joyya too. We've only met a couple of times, but I thought to myself, these are women that I will absolutely want to, if they have a drink with, when this is all over. Anyway, so my name is Dale Merrill. I'm the Senior Vice President of Human Resources and Administration for the Mashantucket Pequot Tribal Nation. It's a small Native American tribe in southeastern Connecticut, small in the size of the community, but certainly not small in the size of impact. The tribe owns and operates the largest resort casino in North America, which is Foxwoods, but also owns and operates a pharmaceutical network. It has obviously, or not so obviously, but it does have a government, and that government requires governmental infrastructure like a police department, a healthcare little a fire department. And so I'm very blessed to have a job in which I get to learn a little about a whole lot. And so hopefully I can take some of those experiences and, and share what we're seeing across all of those different areas within healthcare, within hospitality, within government work, because although it's the same organization, I'm seeing different effects in different industries. So happy to be here.
Thank you. Thank you. All right. Well, Dale, we can now dig on into it. We are about to get started. And so in my opening remarks, I shared some stats that support the notion that women in the workplace have been disproportionately affected by COVID-19. Much of this has to do with equity or the lack thereof. So let's begin our discussion with the notion of equity versus equality. And I believe we have an image that really kind of speaks to that. So let's put that up and then I'll keep talking.
Is that?
Oh, wow. Yes. Okay. Look at what's the matter? It's the same distance. So when I first saw this, I was like, okay, I've definitely had this experience with people, but I'd like for you to kind of just weigh in on what we're seeing here and what your thoughts are on equity versus inclusion. Dale,
yeah,
I'll start.
Yeah, I love this graphic because it so perfectly shows that when particularly men in the workplace say we're working towards the same finish line. You want equal pay, it's all the same. And equity is not the same as sameness. And so, here you have this woman who is being asked to go the same distance, but with all of these barriers. You see a crocodile barbed wire, she's got a shackle around her ankle. And, the question is, why can't she just get to the finish line at the same time as this gentleman that doesn't have all of these barriers? And so when I think of this in the context of COVID-19, I think of those barriers that you had listed out earlier, Michelle, becoming a teacher when you don't have any training as an educator, becoming a healthcare worker when you don't have the expertise or the time to be a healthcare worker. And, lack of access to training that, maybe your male counterpart who is not having to take care of home and engage in all of these unpaid work activities has to do. So in the context of the pandemic, all of those symbols that you see on this slide, you can kind of name what they might be, right? Mm-hmm. So the shackle may very well be a lack of adequate technology at home that she needs to be able to get her work done. The barbed wire may be the constant pulling of her children, because she obviously they come first and foremost in the hierarchy, and here she is becoming trying to be a teacher while still running this race to accomplish her work. Mm-hmm. So that's why I found this graphic, and you can take it outside of the context of the pandemic. and it still works, right? It's not the same. It is not the same. That's really what I walk away with from this.
Absolutely. And Joyya and Cheryl, feel free to, I'd like to hear your perspectives about this notion of equity, and what are your thoughts? Joyya?
So I'd like to start off by saying that this photograph, I think, is really depressing when you think about, all of the obstacles and barriers that do persist. And in the world of higher education, it made me immediately think about the students who had to quickly return home during spring break last year to go back to spaces where it was hard for them to conceive of doing their work. A lot of students go away to school to do that so that they are in an environment where they can really focus on the learning. But sometimes this doesn't work out when you're back at home and you have other obligations that take hold. You're concerned about what's happening with the family that you're in the space with, and then you're trying to accomplish a task that you really need focus for. So when I think about equity, I think about the technology disparities. I think about just some of the basic human aspects, the emotional differences in terms of, being able and confident to get things done, or just the fear of COVID itself and how it impacts people. So this graphic does a lot for me. It brings up a lot of emotion. And although I feel like we're getting close to the tail end of the pandemic, at least my fingers are crossed that we're there, it still exposes the fact that these barriers may still, persist if we don't act now to make some changes to remove them, to make sure that there's equal footing so that we can move forward in a better way.
Right. So, Cheryl, do you have any thoughts on this? If not, I'm sure the audience would be interested to know, how have inequities in the healthcare space affected women during the pandemic?
Absolutely. I love this graphic, Dale. Really appreciate you sharing this, and completely agree, Joyya, with the points that you're making. And, when I see this graphic from a healthcare perspective, it reminds me of a couple of things. I wanted to give a definition of health equity. We use this often in healthcare settings. So equality is sort of, it can be described as, everything being the same. And so this just is such a powerful representation of what might not be the same or might not be different. As you sort of look at the idea of health equity, it's the opportunity to achieve our very best health, our optimal health, without having these structural barriers in place. And this graphic just shows that so well. You could think of the shackle and the ball and chain that this young woman has on her leg, for example, as structural racism and that history, that we sort of bring into our lives, and that really shapes our life chances. And you can think about some of the obstacles that she has in her path, that intersectionality, how we sort of think about sexism and all of these factors that come into play. And we saw this, right, in the pandemic. We saw that disproportionately, some groups I identify, for example, as being a woman of color and being African American. And we saw that this was true, that African Americans tended to contract COVID at higher rates and tended to die more frequently. So though in this country, African Americans and Latino populations in particular are 12 and 13% of the population, we were 22% each of the deaths. And we can't even quantify the deaths of other groups, for example, Asian American populations and American Indian and Alaska Native populations, because we don't even have sufficient data broken up by subgroup to really make that meaningful. So as you think about these obstacles, as you think about the things that we lost and the opportunities that we have, there are just so many parts of this that get brought into the graphic. But I wanted to pick up on a theme that Joyya brought up as well. When you look at this, you can really think about obstacles, but also notice a couple of things. You see that look on that woman's face, her determination,
Mhm.
her gym shoes and her stance, her
Yes.
resilience. We bring a lot of assets to this. And so we have trauma, we have this history, but we've always been able to draw on ourselves, to draw on our communities, on our personal resilience, and to make change. And so one of the things I'm really looking forward to, as we think about what happens both during the pandemic, which is still very much going on, but as we look to a hopeful future, is how we lean on each other and how we come together to build on our assets, to get over these obstacles, and ultimately to clear them out of the way. So thank you for that opportunity.
Amen.
Thank you. Yes, and you know what? I didn't initially look at her face, but now I'm looking at her face, and she's like, really? I mean, what do you think is the matter? But she was like, yes, I am ready to go. I am ready for this. And he's like, what's going on? Why are you looking like that? So thank you. Okay, so let's revisit this concept of the she session, women exiting the workforce. So if you could pull out your crystal ball, what do you think the future of work looks like? The future of work will look like? Dale?
Sure. It depends. It depends. It depends on quite a few factors. It depends on how organizations respond. It depends on how our broader government responds. I'm hopeful that people, because of conferences like this and because of grassroots efforts, that we're setting women up for success, so that this really hasn't taken us back 33 years, right?
Mm-hmm.
So when I say things like it depends, it means that there's going to have to be meaningful legislation around pay equity. I mean, really meaningful. And at the organizational level, it means organizations are really going to have to take a look at the data within their own organizations and take a look at how many women have exited the workforce, and work very hard and intently at getting them back in and engaged and doing whatever that takes. So not simply doing those check the box routines of, reaching out to women's organizations and saying, I'd like to recruit, but really saying, what will it take for you to come back to work? And by the way, this year that you missed does not mean it's a year that you missed so that now I can pay you less, or that I can provide you less opportunity. It's a year that I'm going to look at your experience as an educator now, as a healthcare person, as somebody who took up additional hobbies during this time, for those women who were able to do that, and look at this as experience, not as a gap. So if we don't do that, then we're going to be in trouble. One of the other things that I hope organizations are doing are recognizing, for those women who are working remotely, and men, but that there's a real mentorship opportunity that's being missed right now, because whoever is near you is the one that is getting the attention, and they're the kind of front of mind. And so I'm hoping that there are organizations out there who are developing remote work processes and policies and programs that are focusing as much attention on those people who are remote as they are those people who are physically in the office right now. So long-winded, I want to hear from other people, but I really think that it's going to require lots of little effort, so that this is not really a gap, that we don't look at this and say that 1 year or 2 years, quote unquote, out of the workforce now means that I can pay someone less, or that I value the skills that they gained during that time less, and pick up where we started, or left off rather.
Yeah, that's a good point. In my studies, I've learned that that's exactly what many companies may do, you've been out of the workforce, and so I'm going to pay you less. And, women were already further behind men anyway, so this is just going to drag it out even more. So hopefully, that will not be the case. Joyya or Cheryl, you have any perspectives?
I'm happy to share a perspective. I have to honor my mom, as I sort of think about this, and honor all types of work. My mom worked as a homemaker, so she took care of us and took us to school, and really supported our family, and was the primary, in my mind, if not breadwinner, certainly bread maker. Just kind of putting us all together. And so I just kind of honor, the kind of work that she put together and was able to put for our family, which I realized was, when you sort of get into this position, I happen to have children, and happened to be very lucky that my children were able to attend school, and I was able to get help. There was a snow day. I live in Boston, Massachusetts, and we can get these kind of snow dumps. And I have a 6-year-old, and my son was home for 2 days, and it nearly broke me. I'm just being honest. It was 2 days during the pandemic to sit in front of a Zoom screen and learn what I don't know. Like, it was something related to counting or something, and he getting up and going back. And so, I have all the respect in the world for the work, that we've all had to embrace, whether it's caring for our elders, whether it's caring for a young person. So there's been so much that we've been able to do, and so many skills. And so I hope that as we think about, what work looks like, we sort of think about the multiple ways that we have assets, and we do something bold. We have a real opportunity in this country, as we sort of think about what just happened. Who do we need to rely on? What do we need to pay for? How do we need to support our economy and all the different roles within it? Can we do something unique? Can we do some innovation? Just because your work is supporting family, how does the Biden-Harris administration have an opportunity, to kind of recognize what that work looks like? And so for me, as I think about what the future of work looks like, I really hope we embrace all different kinds of work. And I hope that we also make it easier for us to embrace the kind of roles that we all have. I think, and hopefully we'll have a chance to talk about this and hear what the audience thinks about this too. But I know that there's so much trauma, that comes from feeling like you have to take on everything, like you have to be perfect for everybody, like you have to put all this in place and there's no space for it. And then how do you take care of yourself? So that's what comes up for me when you ask the question, Dult. So I'm going to pause there and sort of and look for other comments. But I hope we can be bold as we think about what the future holds.
I'd just like to echo what you're saying, Cheryl. We have to be bold. There are a lot of lessons that we've learned by being in this virtual space for, jobs that have had to, revert there really quickly. And I know that we have a lot of promise with that. There's been a lot of efficiency and effectiveness that's come out of virtual work. And to Dell's thought earlier, we have to ask people, what will bring you back to the workforce? How can we help you? We have an employee resource group for our mothers called Moms Making It Work. And during the pandemic, they came to us and said, hey, this isn't working. We need support from you as an organization so that we can, manage the different responsibilities that we have. That 6-year-old that's doing Zoom, and we're trying to answer calls and all of these things. And so I think we have to listen as organizations, capitalize on the things that have worked, and then really, get rid of those things that just didn't serve us well. I think we have a true opportunity now to do that. And again, in the higher education space, people are thinking about retooling and reskilling. I know Google is offering all sorts of micro learning opportunities and certificates. I encourage people to take full advantage of that, because those would be the skills and the tools that we'll need to move us forward. So I think it's a lot of promise. You can tell I'm excited. I know that there is a lot that we can do. And again, banding together and figuring out how we can utilize those things that have served us well, I think is going to be the difference here. So
thank you. No, you're good. So Cheryl, actually, you made me think of something when you mentioned your mother and all the things that she had to do, and she probably, to care for your family. So I have a trivia question for you guys. If American women earn minimum wage for all of the unpaid work that they do around the house, being the teacher, cooking the food, laundry, shuffling kids to and fro, a myriad of things, and then caring for our relatives. Mm-hmm. How much money do you think they would have earned in a year just making minimum wage for the unpaid work that they do? Any guesses?
I don't have a guess, but I will tell you this because I read this that the Boston Consulting Group did a survey recently, and they said that women said that they are doing 27 hours more on top of, so 27 hours more unpaid work than they did pre-pandemic. So it's a lot.
It's a lot. So the answer, wait for it, $1.5 trillion. So if women got paid for all the unpaid, just minimum wage, $1.5 million, that is huge. That is huge. So interesting that you mentioned that study, Dale. So I was I read something similar, and that particular study also, it may not have been a study, but it may have been an article, but the men who were interviewed didn't think that the women were working as much as they were during the So there was a huge, so women, so
you get salty.
The women thought that they were, maybe taking on 27 hours more work, and the men just didn't think that. So that was interesting. When I read that, I was like, "Are you kidding me?" And I'm sure, yeah. Okay. I wish that we could see the, I'm not sure if there are any questions, but we from the audience, but we are going to keep plugging along here. So as working women, so all of us are working, I'd like for each of you to share how you've dealt with the stress of the pandemic and what lessons that you've learned. Joyya, I'm going to begin with you.
So I would say in terms of stress during the pandemic, I think it was the uncertainty in the beginning that caused the most stress. The fear of, contracting COVID, or the fear of, potential challenges with employment, thinking about family members who are far away from me. I live alone in a different city. And so just thinking about how, life had changed drastically, and not being able to control it. That was probably very, very pinnacle in my stress. But moving forward, began thinking about, how can I best use this time, even though things are uncertain. And so, thinking about how do you reach out to people and connect with others who may have a similar experience, finding ways to get to your family in a safe way, to just connect and see their faces and that sort of thing. So I would say those would be the things that caused me the most stress. I'm grateful that employment-wise, I didn't have that as a true concern, but I know that there were many others that did not have that same fate. And so my concern for family members who were losing jobs and things like that was stressful, finding ways to support people who were experiencing the pandemic in a different way than myself. So that was stressful. It was emotional. I think we all can agree. One day you're up, one day you're kind of like, oh no, what's going on? Is the world ending? But I think, we're in a better place now. We're able to move forward and think about how can we help one another and move forward in a way that's going to make us flourish. You know, I'm ready to thrive. I'm tired of surviving. I'm ready to thrive. So I would say those would be my responses there.
Yeah. And I know you mentioned that you live alone. And so, you know, I can imagine that being alone and not being able to get out is rather isolating and stressful. And so I'm happy to hear that you were able to find ways to de-stress by reaching out, finding ways to connect with your family. I'm assuming it was a Zoom call or something like that. I know I've been involved with numerous Zoom games and Zoom calls, and so, you know, that's good that you were able to do that. But you know, I mentioned that I am a mother, and I never really thought about, because I was looking at it from my perspective, but from people, you know, about people like yourself who are alone and how that might cause some angst. You know, my stress is, you know, having the 9-year-old come up to me and ask questions while I'm giving a presentation. I'm like, go away. But then I can imagine that there are others who would welcome those questions. So anybody else have any thoughts on how they are dealing with stress during the pandemic and any lessons that you've learned?
Yeah. So, you know, I think for me, for all of us, it sounds like it was just the fear, right? It was the fear. Fear was the underlying stressor, and we had different fears about different things. I have 3 sons and they're all grown, and one does still live at home. So I didn't have the concern about how am I going to manage, but I did have, as a kind of a natural caregiver, this constant fear of how am I going to make sure that all of those people in my life are okay and safe and that they're thriving. So I had to quickly shift from thriving to survival mode, which wasn't something that I've had to do since I was a much younger person, right? Thankfully, I've been blessed enough to really feel like I've been thriving, and now I found myself going back to, this is just about making it through the day. And so I think, I dealt with some anxiety and depression. I have a natural slant to anxiety anyway. And it took this, the form of, you have really no control in your life. And that at any minute, all that you've worked for can just be yanked from you, which is real anyway, right? And so going back, quite frankly, for me, going back to a therapeutic relationship was the upside of all of this. I think for me, I think it's one of those things that I've often told colleagues and friends and family, that it's like hygiene. It's like mental hygiene, going to therapy. But I didn't do it for many, many years. And going back and then normalizing it, just as much as when I go to see my primary care physician, it's no different, was really the upside of this. And then having these types of conversations with other people who really found that, yeah, I went back to therapy too. And this is what I got out of it. One of the bigger struggles I've seen in the organization is that we have people that usually have people who work in 2 different ways. They either integrate their life into work or they segment it. And the people who have struggled the most are the segmenters. Those are the people who work is work and home is home. And now that was not the case at all for them. And time and space really became blurred, right? That, their sanctuary was no longer their sanctuary. People didn't know what day of the week it was. That created lots of stressors, particularly for those segmenters who this is not the way that they thrive in a work environment. And again, normalizing that for them and talking about it and ways in which that they can overcome that, I think has also been helpful for me, who's actually somebody who's able to integrate pretty well. But those are just some thoughts.
Excuse me. I'm glad that you brought up the therapy because I know for communities of color, seeing a therapist is taboo or has been taboo in the past. And but you hit the nail on the head. If you have a cold or if you break your arm, you're going to go to the doctor and see someone.
Yeah, you're not going to just pray on it because that's what
you're not going to just. Right. No, absolutely. You have to do both. You have to do both. I read a book that once said, "Faith without works is dead." So you have to. You have to do both. So thank you for mentioning that. Cheryl, you have any thoughts? Want to add anything?
I do, and I really love the way that we've been talking about it, the way we've been bringing up mental health and how important that is. And for me personally, it's about that honesty, right? It's about being willing to name it, being willing to name the fear, name the isolation, naming the trauma, just saying it out loud, just kind of like for me, just brought so much lightness. Just not having to have that wall up that we often have to put up to present ourselves. There's really there were times where we would send emails out that it's okay to not be okay right now. Mm-hmm. When you ask people how are you doing, you don't have to say fine. We can also acknowledge that we're in the middle of like a really difficult time, and so that was helpful. And I'll tell a couple of stories just to illustrate this. For me, it's just I was at work late, and this was at the very beginning. This was kind of maybe early March, and when things were just about, or I'm sorry, mid-March, when things were just about to shut down, and went to the grocery store, and the shelves were completely bare. It was the sort of, I have not felt quite so isolated, quite so alone. And I embrace a lot of the ways that I am fortunate, the ways that I have, sort of help and I'm able to sort of to work on things. But I just think about what that feels like. As I think about the pandemic, for example, there's a lot of research. So at a University of Chicago, there's a group called NORC, and they did surveys, and particularly women with young children, 20% are 1 in 5 women in their families are suffering what's called food insecurity. So they don't have enough food even to bring on the table. So that just being able to call it out and name it for us was so important. And part of my stress relief for me personally was taking time with family. I'm so lucky. I have a sister, her name's Michelle Clark. She's a life coach. And she did something I never thought was humanly possible. She got my parents onto Zoom. And I have no idea how she did this, but she had got a family Zoom, and we all got a chance to look at each other, to talk to our parents. And that was sort of really important for us, breaking down the isolation. And the other part was getting together and being present in community. Joy, I really appreciated the example that you gave of being really active on boards, et cetera. And our hospital had to do that. One of the roles that I played was I chaired the COVID equity response team for our hospital. And we got out. We knew that there was food insecurity. So we got out and put testing in place so that people could test for coronavirus, and also had food in place. My colleagues did that, Kristen Price, just Tracy Sylvan, just powerful women doing this work. We also stood things up within our hospital. We realized that some women did have children and did need to take care of them while they were trying to take care of other people who were sick. And our hospital was amazing in terms of providing childcare, but some of the subsidies were still not quite enough. Still paying $8 an hour can be a lot of money. And I just want to call out my sister, Normella Walker, who was phenomenal within our institution doing that. So for me, it was about honesty, being able to be real about what it is, looking around me and just realizing that I could I have agency and I could act, and then doing it with a community, doing it with my family, doing it with powerful women who are around me. So that's how I'm getting through it. And there's a lot, we're not done, a lot that needs to happen, but those are some things that have brought me through.
Thank you for sharing. And also, I really applaud you. You dropped some names throughout your, sharing your story. And I think that's so important for us to support one another, to support other women, and to pull each other up. Just because I get ahead does not mean that there's not room for you. And I applaud you, Cheryl, for doing that. So I know that I keep coming to you, but I want to have another question, and this is related to the vaccine. So, we have vaccines, I think 3 that are available now, 3, maybe 4. So what do you all think will be the new norm? What might the new norm look like, once the vaccine, many more people are vaccinated? What do you think? What are your thoughts? New norm in terms of work, how we're living.
I hope we don't abandon some of the positives that have come out of this. So, when people have said, I can't wait to get back to the way it was. And that's not my hope, because it wasn't perfect. So I think that for those women in particular, where this flexible workplace is actually working for them, because it is for some, I hope that is something that continues to be afforded to them. Mm-hmm. I hope people do get vaccinated, but I do understand that there are people, for whatever reason, are not there and won't be there and may never be there. And so my hope is that we're still allowing space for, in some way, shape, or form, for those individuals. So I'm not looking forward to it will be a new normal, and the new normal is a flexible workplace in which organizations actually ask to Cheryl's very good point. You went out and asked, your organization went out and said, what do you need? Joyya had mentioned employee resource groups. I can't say enough about a powerful employee resource group, tapping into them and saying, you tell us, what does work need to look like for you? And so my hope is that it's more about asking individuals and groups what are their needs, and that the employers meet the needs of the individuals, not so much the employees meeting the needs of just simply the organization. So that's my hope for the new norm.
Okay, anybody else?
I'd like to echo that. I think it's important for us to be equity minded. So I'm hoping that our workspaces will have that as their basic principle, that they value that they value shared equity leadership, that they share, be transparent in what's happening, and to bring more women to the decision-making tables. I think once we're at the table, we're able to provide a different lens. We're able to provide more solutions. We do it in our personal lives. We can do it in the workspace. We just need to be sitting at the table more. So I'm hoping that that's what the future of work looks like. Again, asking the question, how, will this work for you, and what can we do to make it equitable? So that's my hope.
Do you, and this is for anyone, do you have any tips for staying connected or proving your value and getting promoted while working remotely?
I just want to say something about what Joyya just said really quickly, because I think it's important, and it's just something that I and a few of my colleagues have started to do. And that is, we as women have an impact just as consumers alone. And so as individuals, the participants today, I know it's a pain, but take a minute to go and look at exactly how an organization's executive team is made up. So the next time you decide to book with Marriott, I don't know what it looks like. You take a look, and if they are all white males, you might want to go ahead and book somewhere else. And so that's really little things like that. The next time you decide to order from a certain restaurant, take a look at who is at that table, because your money, your wallet is really also one of the ways that we're going to make change. And that's got to be, again, grassroots. It's got to be us at this level. So I just wanted to say that about Joy's comment, because that's where we've got to be,
And can I build on Joyya's comment also?
Yes.
I say that exactly. It's just like, it just brought it all up. I want to say one word: anchor. Right? Have you heard the term anchor institution? So that many of our institutions live or are really based in our local communities, and just doing that, like, how do we think about who we partner with? How do we contract? We have a lot of agency and a lot of, quite frankly, dollars, that we have to invest in communities. And so we need to think about that. We need to think about how diverse leadership. There were multiple pandemics that went on, like during the summer. We had to think about all of that. And if we're going to address structural racism, and we're going to address sexism, all these things, we have to invest differently. So I'm excited that you brought that up. So thank you for that.
Yes. Okay, so again, so my question was around working remotely, and we want to give our audience some tips. So do you have any tips for how to stay connected and proving your value, and also getting promoted while working remotely? So I'll tell you this, I've been working remotely for the past 14 years, and I have. And so I'm able to navigate that, but this is new for a lot of people. And there was this notion that, without being in the office and being in front of people, you're not really able to get promoted, and you have to have FaceTime. But this new norm has proven that you don't necessarily have to be in front of someone to show your value and to get promoted. So I'm curious, do you have any tips for staying connected and proving your value and actually getting promoted if that's something that you want to do?
I guess I could start off. I'll just give one tip, is just that I think as women, we often are really excited and happy to promote other people. But you also have to remember that it's important to sing your own song, and to sort of put yourself out there. And whether that means if social media is the way that you sort of do that, so that you are engaged, you have a theme, you have a brand, that you put on social media and sort of keep on that topic. Or whether, like me, if you're an academic, you have a paper or something that you've done, like your science, you put it out there, you talk about it, you accept the invitation to speak about your work, and you just make yourself visible, you put yourself out there. I think that for me is a tip, just making sure to value who you are. And know that people are excited to see you and excited to hear what you have to say, and to share it in that vein. And I think that can help women to sort of get over that extra hump that we often face when we try to promote our work.
Absolutely.
Yeah, I think in that it's absolutely what Cheryl said. You put yourself out there, and you have those kind of uncomfortable conversations with the people who are responsible for promoting you. And you say, I know I'm working remote. I don't want to feel disconnected. Here are the ways that here's what I need from you. It is okay to tell your supervisor, your boss, your department head, here's what I'm hoping you'll get from me. Ask for the stretch assignments, as long as you can do them at your, on your kind of schedule and flexibility. Those are, right now is a perfect opportunity to take on those things that maybe you couldn't take on because they had to be done during a structured time. Take on the additional responsibilities if you have the capacity. But I do think it's about having those kind of conversations that are a little awkward for us, in which you are just clear about your desire to want more and your desire to want to grow in the company, and not to be disconnected just because you're working remotely.
Well, guess what? I just looked at the time, and Yes, you may. Sure.
And I love everything that you all said, but I have an unconventional answer here. I'm going to say give yourself a raise. It might be an opportunity for you to become an entrepreneur. So maybe you can, build your own portfolio doing some other things outside of that one organization.
Yes.
But that's the only thing I would add, even though I love everything else you all said.
Great, Joy. Side hustle.
Yes. Three streams of income, 3 at least. So this has been absolutely wonderful. I have so enjoyed this conversation, and hopefully our audience has as well. We've gotten some great nuggets about how to de-stress, the future of work, getting additional streams of income, making yourself visible while working remotely. It's been great. Thank you, ladies, so much. Also, I would like to thank our sponsors: State Street, Mass General Brigham, Liberty Mutual, PNC Bank, Wellington Management, Cambridge Savings Bank, Eastern Bank, Mashantucket, Pequot, Indian Tribal Nation, Foxwoods, Greater Chamber of Boston, the Dinner Group, Cultural Solutions, and all of our other supporting partners. And before you log off and join the next session, which is going to be awesome, I'd like to also remind you to visit our exhibitors. We have some excellent exhibitors, and you'll have an opportunity to visit with them and learn some more. So thank you very much. Have an excellent day. Thank you.
Thank you, ladies.